answers that you've given to the questions. Really wonderful. Thank you so much. And now I'd like to move on to Annie Hallett, Therapeutic Touch, and she will talk to us about her journey and her experiences and the impact that she's had on patients and medical teams.
Thank you. First of all, I'd like to say thank you, particularly to Dr. Healing Network and to Harry Edwards for having me here, and also what an amazing building and environment and energy there is here. While you were just talking there, and up to I think your question, it came to me that although we're all got a focus working on integrating our approach to healthcare healing, but I just think that although that feels very strongly the direction of travel, and that should be the direction of travel, I just think one of the beauties of not being totally integrated is that it doesn't get absorbed. So healing can still keep its own identity and its own energy. And I think that's really important. It just came to me as you were talking. What came to me was I suddenly realised I'm the person who's actually, in a way, the speaker that's got a foot in, I think, in both camps, if that's the word. My background originally is in nursing, and it never crossed my mind that I would ever get involved in healing, counselling, complementary therapies. I assumed that when I gradually returned to work after a couple of years off after my third child, that I would go back into nursing. And I'll try and be quite brief, but my journey that took me to where it took me was, again, in a way, has similarities and to other people that I've spoken to over the last 24 hours. I'll try and be brief, full of lots of synchronicities. The first thing that happened was I was at a little music group with my 2-year-old, and it was in the early 1990s, and a time when aromatherapy was beginning to be popular. And I saw a pastor saying, come to a 6-week course on aromatherapy and massage. And it's one of those situations where the poster it felt as though it jumped at me. So I go home and I make the phone call, and I'm told that the course is full. It's a part-time evening thing. And by that time I thought, no problem, I'm absolutely exhausted, got 3 children. No, great, I'm let off the hook, Why did I ask to do it in the first place? And the person who was leading it phoned me back, and she said, I feel really guilty that we haven't got a space for you. And I think, don't worry, it's fine, I'm going to put my feet up this evening. So what I've decided we will do is, I won't charge you, you come along and be my model. And I thought, saying no's often been a difficulty for me, so I felt I couldn't disappoint her, so off I went. And the next thing I know, I'm looking at, I live in Suffolk, and I'm looking at a aromatherapy course in one of the villages nearby, Rainbow Star Healing Centre. And before I know it, I'm signing up. I mean, I'd also have to add that I'd been at home with children, and those of you who've been in that situation will know it's actually quite easy to lose your confidence, etc. So for me to sign up was actually quite a big thing. So I arrive and I sit there and I went, oh my goodness, there's an exam at the end of this. What have I signed up for? What? However, I persevered. But during that, I was in the library, and I saw this book called Therapeutic Touch. And again, it was almost like it jumped, not physically obviously, but just the title leapt up at me. And it was written by a nurse, and my background is nursing, as I said. And I thought, this is all very weird. They're assessing people and they're not touching them, and where's the massage involved in this, But I found that when I was practicing, I found that my work was coming off the body more. it began to feel the right thing to do. So we go on a bit, and the next thing that happened was nothing happened, and I'm thinking, what am I going to do with all of this, you know? So one morning I'd arranged to meet a friend at our theatre to go and watch a lunchtime performance, and I was getting ready to go out and feeling a bit frustrated that nothing was happening with can you hear me okay? I sound muffled, is that okay? And I did one of those, gods, goddesses, guides, angels, whoever, just show me what I should be doing. And all of a sudden, the image, and it was so obvious, the image of a ward sister that I previously worked with, who worked on the oncology ward, came into my mind. And I thought, oh, why didn't I think of her? Her name was Jenny. I thought, must contact her. So I go to the theatre, and who's the first person I see? This woman. So I pestered her so that I could do some voluntary work on the ward. And again, I'm trying to cut a long story short. Through that, I think I was in the right place at the right time. I might talk about that a bit later. But whatever it was, I think I raised the awareness, and they decided they've got 10, 12 hours going spare. An occupational therapist who did relaxation work had left. And interestingly, through one consultant in particular, who was very into the holistic aspects of care, and this is oncology, stroke palliative care, etc., and haematology. And they created this Complementary Therapies post, which I applied for and got. And I said, look, I'm actually a nurse, I'm still registered. Can I be a nurse specialist in complementary therapies, please? So that's how the post started. I then thought, well, I'm here I'd already got some counselling qualifications, so I was able to use that. And I thought, well, I perhaps ought to find out a little bit about how you use essential oils with cancer patients. So I bluffed my way through the interview, I suppose. Or they didn't know the questions to ask, and I think that's quite important, because they don't know what to ask, and they're slightly frightened that they're going to employ somebody or have somebody as a volunteer. Because if the management, etc., and the sort of lead nurses, if they don't quite understand what they need to be looking for to make sure that you're a bona fide practitioner, then they're going to be slightly concerned. And I know, as you say, through observation, they begin to appreciate it, and then the questions come as to how can we make sure that we've got governance, which is what it really, and accountability. So off I went to Manchester, and the story, I again almost didn't go, and there was quite a synchronicity and a wonderful meditation that I had, which more or less said, you've got to go. And again, I was happy to back out of it, really, but again, various things fell into place, and off I went. And when I walked in, it was a Shirley Price, I don't know whether anybody remembers Shirley Price in aromatherapy, and walked into the Midland Hotel in Manchester, into the exhibition room, and I thought, looked in the corner, I thought, that looks like a nice lady. So off I trot, and it's a lady called Jean Sarah Adams, American lady, and she's got an exhibition about therapeutic touch. I said, oh, read the book, got the book. And again, before I knew it, I'm signing up to go away for a weekend. I've got children at home, no wonder I was signing up for a weekend. But off I went, and that was my introduction to healing. I'm not going to spend a long time talking about therapeutic touch, because that's not what I'm here for, other than to say that it was an interpretation of healing that was developed originally in the United States by Dolores Krieger, and with the support of a psychic lady, a theosophist, called Dora Kunz. And Dolores D was a nursing professor at New York University, NYU, and she researched the natural phenomena of healing, and she felt this is a human potential within all people. I personally think, yeah, it is, and I think with some people it's nearer the surface, and with others it takes a bit more work for it to manifest. And obviously the healing potential that we each have within us is the really powerful thing. But Dee taught this to her nursing students as part of a master's and PhD, and a lot of research was done, a lot of the older research, on which Dan Benor, and I knew his wife really well, and I reviewed one of his books actually some years ago. But a lot of that, some of that research is based on the research that was done with Therapeutic Touch. It varies. All the research on healing varies. Some of it is quite robust, some of it is questionable. Some of it says, yes, it does have an effect. Others says the opposite. But it's out there, and I think it's part of a long history of research. Because one of the problems is now that we're not supposed to quote research which is more than 10, 12 years old. So that's a problem. But anyhow, I digress. That's how I came across healing. And consequently, I was able to introduce it because I started on the practitioner's course. And of course, I had to have case studies. And I was fortunate again, not only because the people I was working with and who were my bosses, if you like, but also friends. They were an amazing group of people. They were really sympathetic to what I was doing. And I was able to, and they also let me get on with it. And they let me practice it. So that's how I introduced healing into the service. And I think apart from that, I think this is the interesting thing about healing, is it can take you down all sorts of paths, because I don't believe that if I hadn't come across healing, and I've also studied with the NFSH, Reiki, and because I wanted to understand it in more of a wider perspective. And a lot of patients would go to spiritual healers back in the day, in the 1990s, and I wanted to understand what it was that, what it was that they were getting, if you like. I wanted to understand it. But for me, as I was saying, I think healing can take you down all sorts of avenues, not necessarily to do with healing, but will actually perhaps stretch your own potential. And for me, as well as setting up this service in about 93, 94, it also meant that I ended up teaching. I travelled the country teaching Therapeutic Touch, Complementary Therapy, got involved in bereavement support, communication skills teaching, all sorts of things. I did a master's in interprofessional healthcare, and it all helped. But for me, I have to say the two lasting things. One is the healing, which has carried on in one way or another. Well, here I'm standing here now talking to you. It's been more than a thread in my life, and it's done so much for me. At times it's ebbed and flowed. There's times when it's left me alone because I needed to have the break from it. There's times when it's arrived again, and I think that's the way it should be sometimes. And the service which I established, I think I've described a little bit how it started, and I think I was, as I say, in the right place at the right time. I had nurses who were more experienced than me in leadership who said to me things like, Annie, you need to have protocols, you need to have a policy. And I'm thinking, what are they? I mean, I have learned since, because I spent some years working with one of the strategic clinical networks in a strategic role. Well, and policies and whatever, my nightmare, never want to see one again. But in the early days, I was copying the format that somebody else had done, but adapting it. And because now I understand the reason that we need the governance, we need the accountability, we need a framework for practice, and I think that answers some of the questions as well. I think, or not answers, but partly answers. how to actually be accepted and respected is to understand that you can still, healing is going to transcend protocols. The protocols make the way we practice in the health service safe and accountable, but the healing itself is going to transcend those boundaries. But it's a way of being safe, being accountable, and being credible to the medical profession, I think. So the service that I started, and which, as I say, has lasted, I'm amazed. I started it on my own, eventually had some volunteers. I was originally, it was paid for through what we call soft money, charitable money. Then I became a cost pressure, and then suddenly it means that they want you, but they can't afford you. Right, so they they go in debt to have you, right? Something like that. And then, for various reasons, suddenly realised that it was a substantive NHS post. And interestingly, I'll go back a bit. I said that I was in the right place at the right time, and there were, if we look back, I think in the 80s and 90s the NHS changed, and we had a sort of free internal market. Is that right? Is that what they called it? A long time ago. Patients became more like customers. The whole management structure changed, but it also meant that the way, all sorts of things changed. And I think, in fact, there was a sociologist called Ursula Sharma, I think, and she wrote about complementary therapies. And when I talk about complementary therapies, I do include healing, because I think that people who introduced complementary therapies, and there were a lot of us in the 1990s, I think we actually, although that may have been sort of lost, I think we were part of a movement which laid a few foundations. Whether they've been lasting, I don't know, but because of the various influences at the time, as the Ursula Sharma, the sociologist, she did some research, and she said that complementary therapies, alternative medicine, have become part of the narrative of everyday people. It's become normal. So if we think about it, there was a shift in the way, let's just say, alternative complementary therapies were regarded by the public. That's not to say the NHS caught up with it, but there was a sense of people going for aromatherapy, going for healing, that sort of thing. I think there may have been some legislation as well. In 2002, I think I'm right in saying the Parliamentary Party and Science and Technology had healing in their second category, so that it was complementary to other modalities. So again, it made it all more legitimate. As far as nursing was concerned, in the 1990s, there was a movement in nursing for nurses to develop nurse specialists, nurse practitioners, and the ambience then was that we were encouraged actually to be creative, if you were allowed to be. And so that helped me doing what I was doing. And as far as medicine is concerned, and particularly in oncology, and certainly in the area that I worked, which involved palliative care, and our hospice we worked very closely with the hospice. And I think that the palliative care movement at the time, was it Cicely Saunders here, Elizabeth Kubler-Ross in the United States, they brought about a much more holistic approach to dying. And I think for me, my experience is that filtered through. So again, on the one hand, I was fortunate enough to work with consultants who had that sort of empathy. But also, I think in about 1994, in cancer care, we had something called the Kalman-Hein report, which revolutionised cancer care. And one of the things it said was that we could offer complementary therapies, perhaps not in those words, but it made it legitimate to use complementary therapies as part of support. And again, that helped to pave the way, if you like. And so, I was lucky. I was in the right place at the right time when there was quite a lot going on that was in favour of me being able to develop the service that I did. And there were other people. There was, I think what is quite relevant is there was a professor of nursing then called Stephen Wright, and he wrote quite a few articles about putting the heart back into nursing. And I think that was one of the drivers behind myself and other colleagues for wanting to use complementary therapies as vehicles for making that connection with our patients we felt was being lost. And again, listening to what's been said today, that quote about putting the heart back into healthcare just seems so pertinent, really. Again, it's that thread that's of healing in a way, healing intention that seems to have carried on. So the service, just to say a little bit about it, it started off as a one-person thing, really. I was checked out by consultants. The patients would tell me that their consultant had asked how they'd got on with me, so I knew I was being checked out. The service grew so that we had volunteers, then we had paid therapists paid from a local charity, Cancer Campaign in Suffolk, and the service still goes on today. It's now across 2 trusts because the 2 trusts have joined together. That's Ipswich and Colchester. And what I felt was really humbled me, yet filled me with great pride, was that when I retired from the NHS about 4 years ago, they kept my post. They didn't need to. There was no longer any guidance or nice guidance or whatever. All the guidances that came from up top had psychological support and complementary therapies have sort of disappeared, which again is indicative, I think, of various shifts. But that said, the very fact that the posts were kept, I think, demonstrates how useful it was felt to be by the nurses and by the doctors. We had referrals, we had a referral route. Referrals would come from doctors, from the nurses, from other parts of the hospital. We too would go to intensive care. I worked with children quite a lot. Sometimes we would do home visits across the board, and we were involved with end-of-life care and so on. And as I say, I just was so proud that they kept the post, and I know that the charities put more money into it. My job was split into 2. 2 people took my job. I didn't work full time. I worked 4 days a week, and they split that into 2 posts. And it has evolved, and they're still, and they have Reiki practitioners still. So it's still going strong. One of the reasons I've been asked to speak here is that in 2016 I wrote a book, and I felt that for quite some time I wanted to write this book about, and when I say therapeutic touch, I mean healing. But I use therapeutic touch because that's my default, if you like. And I tried to write it. I sat at the computer and the words wouldn't come. And then one evening, the phrase that a patient had used, or the daughter of a patient had used, came to me. And it's a far-reaching thing. And I thought, aha, that is what I'm going to call my book. And from then on, the words flowed, and I wrote it quite quickly. And as I said, the reason I've really been asked is to read to you some of the extracts from the book, because although it's got a lot of other things in it, it's very much a record of patients' experiences of receiving healing. And I feel very strongly that the meaning that people, whether it's patients or their families, attach to healing is so much part of understanding healing, but also as part of the discourse. It's also very useful, I think, in promoting it to the people who have the power to say, yes, you can come and work with it here or not. So I'm going to have a drink of water. And I think I might sit down for this because I've got to juggle with a microphone in my hand, my glasses and a book. Right. It's a little bit like, are you sitting comfortably? So I hope I've picked sections of it which will be pertinent. I thought I'd start with the reason that I called it a far-reaching thing. And now I've just opened the page here, and what it says here, and I feel I would like to read this out. It says, at its very heart, therapeutic touch, healing, is a way of communicating compassion. And I think that's, to me, that is what it's about. It's about compassion. And within that word compassion is the sense of love and the purity of that at its very essence. But the story of the far-reaching thing is I was called one day by the hospice and asked if I'd go over and see this chap who I had worked with, I'd been doing healing work with. And he had leukemia. And he was a big, sort of gentle giant of a man. I can visualise him now. And he'd come to the end of the line, really, and he was in the hospice. And he'd asked if he could see me, so they had their own complementary therapy service, which I was involved with setting up. But we worked together, because patients went backwards and forwards. So I went over, and I'd been really busy that morning, and I was full of a cold. So I went there. His daughter was sat at the end of the bed, and I nodded and did the usual preparation. Checked, he was drifting in and out of consciousness, so I checked with him and the daughter that it was in fact okay to do therapeutic touch, and he touched my hand, it was a yes. And to be honest, I wasn't paying too much notice to the daughter, and did therapeutic touch, and when I finished, she just looked at me and she just said, it's a far-reaching thing. And I thought, yeah, it had although I wasn't working on her, it had affected her. And I know that quite often if I was working in a ward, a side room, or even in the chemotherapy day unit, because I would often be asked to go and help to calm somebody down if they were feeling really anxious, and everything would go quiet, and people would say, and the nurses would say, you can feel it, there's a change. And that's one of the ways that, certainly with the nurses, some of whom are not familiar with it, how they came to actually appreciate it and talk about it and ask for us to go down and to help out with patients who are feeling anxious. I think we know that healing can often make people feel relaxed. So if somebody's anxious, of course, we would use it. I've never used it with therapeutic touch, our intention is simply to have a non-attachment to the outcome. It's simply with our intention, our compassionate intention, to facilitate whatever healing is right at that time for that individual, which me personally, I've never thought in terms of curing or working physically. I work much more personally on the emotions, which is just me, just the way I work, or it's transpired that I've worked. So just bear with me. I'll try and do this with One hand. Yeah. I think, yeah. I'm sure most of you know that the word healing comes from the old Anglo-Saxon Harlem, meaning to make whole. And I think if we feel at home, we often feel at one, don't we? It's about being at one with our world, feeling connected, feeling integrated, if you like. And it was this lady a long, long time ago, in my very early days, and I can see her so clearly in the hospital bed. Lady with breast cancer, very weak, very poorly. She was older than me at the time, but younger than I am now. So I realised how young she actually was. And she was aware that, and again, you have to remember that in the 1990s, even in the early 2000s, chemotherapy hadn't advanced, and quite often people with breast cancer, they weren't the same. There might be first and second line chemotherapy, but there wasn't the sophisticated treatments that there are now. So this lady was dying. She knew that there was nothing more that could be done. She wasn't well. We did therapeutic touch, and she just looked at me and she said, I feel at ease. I feel at ease with myself. And also, she said, for a while there, I completely forgot that I'd got cancer. And I thought the idea of feeling at ease with yourself was quite profound, really, particularly in that situation, that oneness. There was a couple of guys that I saw. One of them came to me simply because I saw outpatients quite a lot, so I had my own clinic, and so often helping work. And he came and he said, I only came because nothing else seems to be working, so I thought, you're available, I'll give it a go. And he was amazed at the change that it had in his perception. He said, I just feel as though I am more accepting of my diagnosis. And he did, in fact, not relapse, the opposite of relapse, for some time. I think that was as much to do with the chemotherapy and bone marrow transplant as it was to do with anything that I did. But he did come back when he relapsed because he found it such a valuable adjunct to everything else that was going on, and respite, I suppose. But the other person, I've opened the page on what I call it with a little help from TT. Some people simply wanted to come because it gave them several days of feeling relaxed and less stressed. And there was one lady in particular that I remember and that I wrote about. She was in her 40s. She'd got ovarian cancer and was getting to the end of treatment possibilities. There are so many. As I sit here speaking more from my head than the book, I'm thinking there are so many people. But this particular lady, she'd got young children, and her husband wasn't the most helpful of partners for her. And she just was quite open. She said, I just come because I find that I get several days when I feel less stressed. And for me, that's so important because I don't want to be snapping at my young toddler children. So again, I think that not only demonstrates the response, but what it meant for that person. There's another thing that comes to mind, which I think I've written about, was another lady who I first came across because she was given the news that her breast cancer had returned, young woman, and with young children. And she was absolutely, as you can imagine, beside herself. And I was asked if I would go and if I could do something. So she came to my room, and she was so upset that really, the only appropriate thing to do was to try and ground her. I'm sure most healers will understand that there are times when that's all you can do. But she asked to come back, and she came back quite regularly. And she's an example of somebody who, she'd come and she'd talk about all sorts of things, and she shared something quite important and traumatic that had happened to her. Almost as though, and I'm sure again you healers have found this, that often in healing people will suddenly share things that have happened, but certainly towards the end of life, sometimes these traumas almost have to be taken out and aired and allowed to go as much as they possibly can. But she became very poorly. At the time I used to do a relaxation CD, and she had one of these, and eventually she died, and her mother came and sought me out, and she said that when this lady, I think her name wasn't Diana, but I think in the book I call her Diana, I can't remember, but when she was actually dying, there was a point when she was very frightened, and they said they played the relaxation tape because she'd benefited so much from coming to have healing, therapeutic touch, that they thought to hear the voice would be something that would be of comfort to her. And again, I think that's something that's indicative of how it's far-reaching, because the family resorted to that because they knew that it was something that had helped her. And I could quote quite a few situations like that, and it always sort of surprises me in a way how, and certainly not always, because there'll always be people who will be frightened of what we do, but how quite often families will walk into a room, they'll see a strange woman they've never met before standing over their loved one with their hands moving above them, and they won't bat an eyelid. Because I think at that moment, at that time when people are dying, there is that space, isn't there, that you enter if you are with a loved one. And it's almost, it's neither here nor there, it's that space in between. I think at that time your radar is very perceptive, and you know who's honest, who's not honest, you know who you can trust almost. But I also wonder whether actually there is something very innate that we connect with that makes people register that somebody who is doing this healing, working in that space, that it's actually quite natural and quite meaningful. So therefore they attach to it something really important and profound. And I can think of times when families, one family in particular who was travelling back from Cornwall to be with their mother, daughter, who was dying, and who actually had died. And when I don't think they knew about healing, but when they'd been told that she'd had healing, they were so thankful. And again, I find that fascinating, that people should connect in that way. But to go back to the more sort of, not mundane, but there's this chap, I'm just going to put this down when I find the page. This is a chap who, I'll read it out. He's another skeptic, I put. He says there was, Simon was about 33 years old, and he was trying to adjust to life, work and love following a bone marrow transplant for lymphoma. This can be a long, lonely journey for anyone, and Simon, feeling he was just starting out on life, understandably had a multitude of conflicting and painful thoughts and fears going through his mind. And facing an experience of transplant in itself as an intervention, which demands the finding of an inner strength that most of us never need to access. Anyway, Simon described this particular session of therapeutic touch healing. He says, and this is actually what he wrote: "First, I feel a need to state that I am a male with a leaning towards engineering. All of a sudden, I stop, thinking of these things on my mind, and I become aware of a gentle pulse in my head. There is a strange divergence in myself. I feel myself relax, but there is a small part of myself which is witness to this change. It doesn't think about previous concerns. It just observes what is happening to my body and mind. I am aware of my body and mind becoming more relaxed, like being in a deep sleep. Then Annie asks me to slowly come back. I try, but a sudden emotion, all the fear and worry of the cancer coming back, seems to leap out of nowhere, and then it's gone. I feel very weak or relaxed. I can't tell. I try to explain that it was the fear and worrying that seemed to come out of nowhere and then was released in some strange way. And as I say, that's his words completely copied. He did relapse, and he had regular sessions of therapeutic touch after that. I'm just checking. Right. What I'd like to end on is what I found was one of the most profound experiences that I've had, certainly, involving healing. And again, I'm going to have to find the page. One afternoon, am I okay for time? Yeah.
Just a few minutes.
My watch is slow. Oh, that's fine. One afternoon, a colleague asked me if I would go up to the ward and see a patient, a youngish woman dying of breast cancer who was well known to the nurses and slightly known to myself. I'd seen her once or twice for counselling, but not for therapeutic touch. And I have to say that, again, the nurses, palliative care nurses, would often come and asked for me to go up. She'd had reflexology with one of the therapists though, so she was known. I'm going to miss some bits out. She'd been admitted as an emergency, and the cancer had spread to her lungs, so her breathing was really hard, causing real problems, and despite medication she was very agitated. She was in one of the side rooms and I was asked to go because she was so unsettled. When I entered, I was confronted by a frantic scene. Diane was sitting up in bed, extremely restless, not being able to breathe or settle, and she was very hot. Some family members were gathered around, and one of them was frantically holding an electric fan in the air above her head, trying to cool Diane's face. They're obviously trying to help. They'd got music playing, but it was like slightly frantic music. And you just knew they wouldn't feel comfortable until she felt comfortable. And I knew that they thought I was going to work some miracle with this woman. And I was confronted with this really frantic energy in the room and this agitated woman. And I'm thinking, help. And again, it's when that ego and expectation, you have to try and put it to one side. So I knew I had to centre myself with certainty and remain centred. Even though, as I say, I was battling with my ego and I wanted to show that I could do this, that sort of ego, which I really had to put on one side. And I reminded myself that at its heart, therapeutic touch is devoid from the neediness to prove. It was my own need to make it right and to be seen to make it right that was getting in the way. So I started to move my hands, starting as usual around the head, a few inches away from the body, and moving downwards, sensing different patterns, what we often call the energy flow. But I found my hands wanted to stay, first of all, in the area of the head, where it seemed quite hazy and busy. But when I moved downwards towards the middle upper back, my hands wanted to stay there. But Diane was sitting, leaning forward on a bed table. And suddenly, as my hands spontaneously lingered over what was probably equivalent to the chest area or the heart chakra area, I felt a drawing sensation in my hands, as if they were being sucked into a vacuum. And I can remember thinking that, I don't know what's happening here, but I knew I had to stay with it till it had passed. I couldn't have moved my hands away, such was the pull. I was mystified but not alarmed. I just knew I had to go with it. And I found, I've missed that little bit out as we're short of time. After a while she settled enough to be able to lie down. And I found some soothing music. And I went downstairs from the ward to collect some oils and music that I felt was more calm and peaceful. And I was totally focused on what was happening. And it was as if I was being held right in the middle of something which felt cushioned and safe. I felt at peace and totally, this is me, I felt at peace and totally present in that space. And I was tempted to stop and speak with another patient en route, which would perhaps be my habit, but something made me quite clear in the knowledge that I shouldn't, that it could wait. And looking back, it was as though I was intuitively keeping in the space, focusing on what was happening with the patient, even if I wasn't physically in the room with her. Later on, I remember that I'd experienced a similar feeling, which I can only describe as a sort of state of sublime bliss, when many years before I had lost twin babies I was expecting long before they should have been born. And I wasn't aware of this at the time, but I just felt this experience. I couldn't understand why I felt so at peace and overwhelmingly contented, but yet again, I was experiencing this feeling. It's that space in between life and death. Anyway, I gathered my music, my essential oils, frankincense and rose, which I generally use at these times. Those of you who know about oils will know why. And when I got back to the ward, I bumped into the patient's sister, who was insistent that I return and carry on where I left off. Again, you've got the family so desperate that something should be done to alleviate, and so trusting. But when I went in, all the other family had gone, and Diane's parents had arrived, and they were seated by the bed when I came back into the room. And I felt that they weren't that happy that I was there, but I checked with them and they sort of said yes. But as time went on, we all sort of worked together, if you like. And what I found was that I normally, my understanding and the way that I've always been taught and feels natural to me is when I'm working with the energy flows to work downwards. But I found I was working upwards. And it was almost like a reverse of birthing, if you like. But as the end came nigh, the connection between the parents and myself and the patient became so obvious. I've written about it and I can see Alison standing there. So I'm sure you get my drift. And I really wanted to end on that because I hope what I've managed to do is to cover sort of how it came about, how I was fortunate to be in the right place at the right time, how working within guidance and accountability and governance is really important, but also how, hopefully, by some of the experiences that I've recounted, how that just demonstrates how important it is for patients. And I think before I finish, the last thing I will say is that I was asked, I think, to mention about doctors and nurses, and I think some really appreciated what I was doing, but were not going to put their head above the parapet and actually say publicly. But I think there was a huge relief that there was somebody there doing something, and therefore, they wanted it to carry on. And you talk about being under the radar. That's actually quite important. You quietly, and I've used the word today earlier with somebody who was here, it's about weaving. So thank you very much. I hope I've made some sense there because I've just talked.
Okay, we'll be back with Sandy Edwards in a few minutes after the Q&A.